Morning, everybody. I'm David Fullerton. I'm one of the training co-chairs for the Minnesota Community Corrections Association, who is putting on today's training. A couple housekeeping pieces for those who haven't been here before, which is many of you glad. We have food and coffee and drinks and everything right there. Eat. Bathrooms down the hall, first door on the right. You don't need a badge to get to the bathroom. For reasons unknown, you need a badge to get from the bathroom. Badges are on the back table over there. Feel free to grab one as you need. We're going to go 9 to noon is when we're scheduled for. However long Rachel goes is how long she goes. We'll take a break around 10:30. So today we have fetal alcohol spectrum disorder or disease? Disorder. And today's presenter is Rachel Teedy, who is with Pathways Counseling Service and is a counselor there. She's also an old hand speaking here. So take it away, Rachel. Thank you.
Thank you. How are you guys? Good. I see a lot of familiar faces, which is, it's falling apart on me again, but that's okay. Which is fun. So I'm Rachel Teedy. Like he said, I do work at Pathways Counseling Center. I've been there for a while doing all kinds of different things. I also teach at Hamline and Concordia universities and do a lot of presenting. One of the big topics I present about is FASD. How familiar are you guys with FASD? Kind of, a little, not at all. This is your first time hearing about it. A little? Okay. I just want to make sure because I go into some basic stuff and I don't want to bore you if you've heard that 1,000 times, but I will go into some of the basics so we get introduced to it. All right. A little bit about me in case you care. Well, thank you. And I'm going to start with a video. And then I'd love to get your reaction to the video. When I first saw this video, I was blown away. And I hope you guys are too. I hope you understand. This is a guy named Morgan. I don't think this is going to stay together. Who's a speaker for NOFAS, the National Organization on Fetal Alcohol Spectrum Disorders. And he talks very articulately on his disabilities and how they impact him. So.
My grandchild lived that day and time. When I'm 19 years old, I'm an alcoholic. My mother drank 90 to 100 days during pregnancy, so I lived with many of my own FASDs. I have both physical and neurological disabilities. I have spinobifida, scoliosis, submucous cleft palate. My eyes focus at 2 separate times. I have other sensory integration problems. I have deformed hips. I have many learning disabilities. I have short-term memory. I have the cognitive skills of a 4-year-old. I have the overall brain development of an 11-year-old. It's not easy living with my FASD. It's not just for me, but for my grandparents, because they're with me every step of the way. They're my external thread. They work with me, and they help me be successful. I had no clue that I was struggling because parts of my brain didn't develop. I was struggling because my body didn't develop right. So I simply felt stupid. But the more I read, the more I realized I wasn't stupid. The more I read, the more I understood why I did or didn't think in certain ways, why I did or didn't understand certain subjects. And that was huge. It was like 1,000 pounds was lifted off my shoulders. I can't tell you how many times people said to me, well, I don't want to label my child. We don't want to have a diagnosis because that's just going to be saying that they have a problem. Well, denial doesn't help, but acceptance and knowing that you have a disability where you lie not only brings relief, but it also gives you a base of where you need help.
All right, well, I pull up this. Do you guys have some thoughts on Morgan? So it's not just me talking? Yes, please.
Well, I saw him present in Minneapolis, just a
Ooh.
few years ago.
Okay.
I don't know if you were aware of that.
No?
Yeah.
I know it's travel speaking.
Yeah, it was fascinating, and it was a very small gathering, and he played his flutes in between, and he explained how that helped him develop his math skills. He had used
Excellent. That's good to hear. I know music is a big part of his life, and I know he does travel speaking. I'm glad you got that opportunity. Other thoughts on the video? Yeah.
I noticed that you said he had the cognitive abilities of a 3-year-old or something, and then the brain development of an
11-year-old.
So well spoken, and clearly understands his disorder, which probably makes it so undetectable out in the community if somebody's suffering with this, and it's not so obvious.
You know, absolutely one of the key things I want to talk about today and why we really like to bring FASD to people in corrections. Looking at him and hearing him talk now, you wouldn't guess it, would you? You wouldn't guess all this is going on because we don't have our brain scanners to see exactly what's going on in Morgan's brain. But without all this incredible support and nurturing he got along the way to help cope with his disability, he wouldn't be where he is today. So, yeah. No, please, go ahead.
That's powerful because oftentimes, like you said, people like maybe dealing with FAS or mental health issues feel ashamed and they won't even go towards getting help. You know, but to me, he's a prime example of, you know, if you get the help that you need, how things can change.
Great, absolutely true. I'm actually currently working with a mom whose son is 15 and he has Asperger's, or now I guess we'd say autism level 1. But there's definitely something going on for this kid. She refuses to get an official diagnosis because he wanted to be a pilot when he was little. If I get him diagnosed with autism, Rachel, there's no way he'll be able to be a pilot. Well, right now he's not going to graduate high school. It looks like he's going to drop out as soon as he can. So where do we, you know, it's tricky waters to navigate and it's tough to kind of tiptoe around because yes, I understand your concerns. We don't want to label, we don't want to, you know, do all these things that might detriment our kids' future, but we have to give them the tools to succeed, to be able to get through. And without those tools, it can be a tough story. So thank you for bringing that up. Yeah.
You know, the other barrier I see with this is not only within American culture, but within the criminal justice system and what that looks like. And, you know, dealing with the guys within the department and encouraging them to talk about these issues and look at them and that tough guy facade of, nope, you're not going to label me, nope, I'm just going to act out. I don't want to be called stupid, and trying to educate them on that piece of what, you know, some of that criminal thinking is telling them versus what's really going on, and to have that level of self-awareness is just amazing and, you know, really benefits the guys once they take that step back and really can start saying like, oh wow, it isn't just me, like there is something else. So it helps me get some of that, you know, like you said, like, oh, the weight's off my shoulders. I'm not dumb, I'm not whatever. So
Absolutely. When we can bring that and then understand this is what's going on with me. And in prisons, it can be a tough place to admit that kind of vulnerability or that kind of disability. So to be able to find safe ways for people to come out with that can be very empowering and help them be more successful in prison and when they are released to the community. Yeah.
well, and another barrier I see is the lack of actual testing for it. So it's so frustrating when I'm banging my head against the wall because I know that there's so much more going on, but we don't have the resources within the department to, you know, refer them somewhere. They're not going to pay for it a lot of the times. You know, it's like what can we do to bring more awareness and get more diagnosis done so that we can actually help these guys? It gets frustrating.
Oh, yes. And one of the biggest things that we talk about when we're talking about FASD is the struggles to get people diagnosed, because it is really hard to get a diagnosis. We have to know mom drink. Interestingly enough, when I have been in a prison setting, and it's not something we usually ask in our screening tools, but I've started asking people, especially when they've been in the criminal justice system, do you know if mom drank when she was pregnant with you? And an alarming number say yes. I do actually know mom drank when she was pregnant with me. So if that many are telling me yes, how many more moms drink that we don't know about? The statistics are just through the roof if we could get a way to diagnose accurately and more easily. But right now the U does testing, MOFAS does testing on under 18, but it's hard. It's really hard to get a diagnosis. So what we've started doing is, if I have this individual in front of me who's fitting all the criteria we're going to talk about today, They've been through multiple treatment programs. They're unsuccessful. They're having a hard time controlling their anger. They had special education in school, all these other things. Maybe I don't need to know. Maybe I can just treat as if, so that I could use some of these intervention strategies without the formal diagnosis, because the formal diagnosis is hard to get. Awesome. Final thoughts on that before we move on? Great.
For me,
Yeah.
working in the CD field is, I find it challenging when, because sometimes kind of things that you just adjust the CD file and not go into the file. And the hardest thing I find is trying to integrate that and explaining to them, to get them to actually accept the fact that if you're dealing with a mental health diagnosis, it's more beneficial to treat both of those. So it doesn't make sense that you become completely blind, not deal with it. So sometimes I find that really challenging.
Well said. Very well said. When we're looking, and we're going to get into statistics in just a few minutes, the rates of mental health disorders and chemical dependency issues is through the roof. So when we're looking at these, especially with somebody with a developmental disability, such as an FASD, we really need to treat both. Because if we treat the CD without the mental health, we're going to be much less successful. And if we don't incorporate some of these strategies specifically for FASD, we're going to be even less successful, because we're treating as if they have the brain comprehension and ability to understand and to follow through. Where again, with Morgan, it looks like he does, right? But that's taken years for him to get to that point, and he still requires extra support and extra help to get there. All right. And please feel free to interrupt, add your own experience at any time. I like to hear from you guys too. All right, it was first diagnostically identified in the 1970s. There's research and, kind of folklore and stories going back from biblical times and before. This has been known that there's something going on when mom drinks when she's pregnant since the beginning of time. However, we didn't start officially diagnosing it and really looking at it as how it impacts development and impacts functionality until the 1970s, which isn't that long ago. So if you think about how far we've come since the 1970s, it makes you wonder where we'll be in another 30 years. It's a lifelong disability. Rates are estimated between 2 and 5% of the population. Whenever I give this talk, and once you start to see some of this, a lot of people venture to say it's even higher, because we're not diagnosing it. But we're estimating between 2 and 5% struggle with this disorder. Condition based solely on the consumption of alcohol during pregnancy, the brain damage is irreversible. We can learn skills and we can learn strategies to help cope with it, but it's irreversible. And it can range from mild to profound. I've been at places and talked to people where they say, well, this person has FASD, so they don't understand. Well, that's not necessarily true. Like anything else, it's a spectrum disorder. So we have mild impairment, where maybe they struggle in just 1 or 2 areas and might struggle a little bit, all the way to the severely, profoundly impacted, where we're looking at group residential facilities and other things because they can't function independently. So I never say always in any of these cases. There is always brain damage, but anything beyond that we can't always say is the case.
Rachel?
Yes?
Now, I noticed it says solely alcohol. What about other chemicals used?
Great question. Today we're just going to talk about alcohol, but a lot of these effects can be seen from other substances. I do know that inhalant abuse can very much mimic FASD, but other substances can be a whole other topic. So, great question. Yeah?
You know about rates in other countries?
Yes, I do. That's a great question. Where do you think is one of the highest countries where moms drink? Yeah? Russia. Russia's high. What else? My family forever ago came from there and we just celebrated them. Ireland. Actually, tragically, high rates in South Africa. South Africa is really right now. Lots of research being done there on why, but and we can talk a little bit more about that later, but great question. This is what it is here, but here we have education. We have a culture that might say it's okay to have 1 or 2 when you're pregnant, but a culture that generally knows it's not okay to binge drink when you're pregnant. It was so interesting. Quick, yeah.
I look up and I know which has a huge number of Russian adoptees in the transition system. So we
Adoptive parents is a very complex issue when it comes to this because so many individuals with FASD are adopted because it just makes sense. Mom's drinking when she's pregnant. She's not anticipating on following through with raising the child. Mom's having her own issues in a lot of cases, not always, but in a lot of cases. So then we have children that are put in the adoption system without adoptive parents fully understanding, number one, what is FASD and how could it impact the child, and number two, if mom even drank. It's not always disclosed, so we don't know. So it's a very big problem coming through the adoption system, and actually Lois Bickford talks a lot about that because she adopted 2 girls. They were told there's nothing wrong, everything's fine, and then very young they were diagnosed with FASD, but this was back in the 70s when nobody really knew what it was or how it was going to impact. And she tells a great story about how both of her daughters are severely impacted every day because of their FASD. Great question. The other point, talking about our culture and how we know that it's not okay to to drink when you were pregnant. I was working in a group therapy, and for MICD, and one of the women said, you know, my son has FASD. I drank when I was pregnant. I didn't know I was pregnant until I was 5 months pregnant, and then I had my last drink that night and I stopped, but I was 5 months pregnant, so it was too late. Another girl in the group said, I can't believe you did that. I mean, I smoked meth the whole time I was pregnant, but at least even I knew not to drink. How do you handle that? I had no idea what to say. So we processed that and worked through it a little bit, but even I knew not to drink, but meth is okay. So going to your substances. It's very interesting. Cultural perspective.
Well, you know, I even noticed that when you ask some of the guys, did your mom drink? Well, no.
Yeah. The offensive question. What do you mean? What's wrong with me that you see that makes you think that mom might have drank when she was pregnant with me? But talking about other substances can take away some of that stigma. There is definitely something about drinking. So, great point. All right, so what is it? Let's get into some of the basics. It is a spectrum disorder. We have fetal alcohol syndrome. This is where we have the facial features that you're going to see in just a little bit. Partial, you're seeing some effects, alcohol-related birth defects, and alcohol-related neurodevelopmental disorder. All of these fit under the umbrella of FASD. What happens when mom's pregnant? We probably have a lot of parents in the room. You're pregnant for 9 months, right? A lot of times when we're looking at FASD, people think of the facial features. I even had in a prison group somebody say, well, I knew mom drank, but I didn't think I had it because I thought you had to have the facial features. Well, the face is only developing in a very short period during gestation, right? But what's developing the whole time? The brain. The brain develops the entire time. So these other outside effects that we can see that make it more obvious to us are only if mom drank to an excess during these points of development. But the brain is always impacted. All right. Here's some of the things that you're going to be on the lookout for. The abnormal facial features. This philtrum, this little bump right here. Now you guys are all going to go look at the bumps of everybody in the room. I know you are. This gets flattened and smooth, and I've seen some more severe cases where it's completely gone, just completely flat and smooth right there. Small head size, shorter than average height, low body weight, poor coordination. One more story. I was working in a group, and one of the guys raised his hand and said, Rachel, I have FASD, and he was so excited and proud, and it was very sweet, very endearing. Do you know how they found out? One of my ears is bigger than the other ear. And so I came in here, they noticed my ears were different sizes, and they got me tested, and I have it, I do. So it's one of these things where he was embracing it and knowing where it brought his challenges, and it came from noticing different ear sizes. Attention, poor memory, hyperactive behavior. How many of our clients does that describe? Most? Learning disabilities. We want to talk about what happened when they were young, because the facial features, the learning disabilities, some of this other stuff, you learn skills as you get older, whether you're diagnosed or not, oftentimes to get through some of this. I don't know how many people in this room were in special ed when you were a kid, but if I ask you and know, then I know that there's a sign. There's one sign, we're just ticking off one of the many signs. Intellectual disability or low IQ, just to speak on that, we often see low IQ, but not always. Don't assume somebody doesn't have it because they're highly intelligent, because it can present with high intelligence, just usually not. Sleep issues, we give full trainings on that, because the sleep issues, when you're a parent, adoptive or biological, with somebody with an FASD, sleep is a really big concern and a big problem for these people. Some physical disabilities and problems in school. So to give you kind of a cultural perspective, you brought up the culture earlier, and you too. Culture is a really important thing because different cultures have kind of naturally different features. So you can see the smoothness, and then the eyes, and the size of the head from different cultures. I'll give you a second to look at that. But again, remember, they often grow out of this. So we want to say, what was going on early in school? Can I see a baby picture? Can I see a picture from early in life? I was part of the FASD Diagnostic Consortium one day, and these physicians talking about how they can measure. They can look at the picture or look at the person and measure the eyes compared to the head, compared to everything else. It was really fascinating. Okay. The region's effective. Bonus points if you can tell me what the corpus callosum does. Yes?
Shifts information left hemisphere to right hemisphere.
Absolutely, you get bonus points for whatever it's worth. Shift information from left to right, the thinking and the feeling. It can be damaged to almost completely gone in cases of FASD. And this is really important when we're talking about the criminal justice system, because what happens if I get in trouble legally? I'm expected to think, to say what happened, but I'm also expected to show some feeling, right? Show some remorse, show some guilt, show how I'm feeling about it. If I have damage to my corpus callosum, that's difficult to almost impossible. So knowing that people might not be expressing the affect we want, or able to explain what happened the way we want them to, maybe it's, for their own secondary gain, but maybe it's brain damage that's not allowing them to process that. Cerebral cortex, hippocampus, and cerebellum, and you can see the differences in the brains here. We'll get you some more brain pictures. One study examined the brains of 28 children between ages 6 to 17. They found that there was damage, including an overall reduction in the gray and white matter and overall volume. The brain can actually shrink and be smaller. If I had my way in every prison and every detox center, I'd have my Rachel Magic Brain Scanner, and I'd scan everybody as they're coming through. So I can see, what is the brain size? Is there damage to these areas that we're talking about, so that I can more tailor my intervention strategies and the community living environment to the person with this kind of brain disorder. But I don't have my magic yet. There was damage to all the areas. However, the differences in the amygdala was only present in older children with FASD. We have primary disabilities and we have secondary disabilities. Primary disability, what happens when the brain is impacted? We have damage to the corpus callosum. We have an overall reduction. Secondary disabilities, what's happening in my life that impacts that? Because I have this, I have higher rates of depression. Because I have this, I have higher rates of conduct disorder, antisocial personality disorder, bipolar, schizophrenia, ADHD, very high correlation with ADHD. So what does the brain do? I don't know about you guys, but I tend to forget. I know some of the basics, but in case you were wondering, there you go. Hippocampus we talked about with damage, memory, learning, emotion. Some really key factors when we're looking at a criminal justice population. We also talked about the corpus callosum, we already mentioned that. Cerebellum, coordination and balance. You saw in our earlier slide about some of the features where there is some of that clumsiness that can come out. That can be the brain. One of the most alarming pictures I show, but it really speaks volumes to me. Normal brain, I hate the word normal. I should go in and change that somehow to average, but I'm not that tech savvy. Average brain, FASD affected brain. You see the need for the brain scan, don't you? Heartbreaking. Actually, this is from an infant who was so severely affected they didn't survive. That was that brain, but shows in severe cases what can happen. And then there's a whole spectrum between there and there. Another comparison. Let's take a look. See much difference? You'll hear people, especially people that have had a lot of support with FASD, talk about their brain like Swiss cheese. The information might be there one day. One day they might really know how to tie their shoe. They might know how to tie their shoe for weeks, and then one day they don't. Well, that looks to a lot of us like, yes, you do tie your shoe. Like my 8-year-old. Yes, you do tie your shoe. I know you know how. You didn't suddenly forget. In the FASD affected brain, they can. The information can just be gone. That can be very frustrating for professionals, parents, caregivers, support staff, anybody involved, because you've known how to do this forever, now this information's gone. But when you see the brain and how the brain is challenged, it makes sense.
It's not even just the brain.
Absolutely. Absolutely. The whole thing has damage. You can even see in the face where that comes through, how that varies. Corpus callosum abnormalities. Again, I put this in especially for corrections because it's very important when we're dealing with corrections. Here we have what it should look like. And then we have this whole range of what it does look like. Oops. Gray and white matter, there's what it should look like, but that can all go away. Shrink, reduce, either mildly or greatly. Again, we don't know the impact of each individual. And I always get asked, I know it's coming, so I'll just preempt it, how much alcohol is too much? What do you guys think? How much is too much? How much takes this gray and white matter and gets rid of some of it?
Don't they say it's like a gamble? You just have a little bit and you do it for a lot more.
Absolutely. Very well said. It's like a gamble. I've heard people refer to it as Russian roulette. We don't know. We don't know at all. I've never heard of a case where it's 1 or 2, but we hear of cases earlier and earlier. Some doctors say if it's before so many weeks, you're okay. We've heard of other cases where it happened before so many weeks. Women don't always know they're pregnant. For how long? So what are we doing when we don't know we're pregnant, and how long is that going? Is it one binge drinking episode during the entire 9 months? Is that enough to do it? It's just a gamble. It depends a lot on mom's biology, baby, how alcohol is processed through mom. So it is a gamble. We really don't know. That's why they say none. Just stay away. All right, neurocognitive functional impairment. Again, low IQ score of 70 or below, not all the time. It is common. Executive functioning is one of the biggest things we're going to talk about today. Trouble planning, organizing their behavior, behavioral adaptations. Do you guys see some of that? Every day? Yep. Executive functioning is a big one. Difficulty keeping up with their peers when learning. Understanding right from wrong. People with FASD can be very friendly. They want to be your friend. I've heard stories of a woman who had FASD about my age, but years ago when we were both younger. And she would meet some gentleman at a bus stop, and he would say, "I'm your friend, can I come to your house?" And she'd say, "Great." So mom would come home, and daughter, who was in her early 20s and very developmentally delayed, would have strange man in the house who picked her up at the bus stop saying, "Mom, isn't this wonderful? I have a friend." Very overly friendly and very eager to please. So that's something to really watch out for. Also, it makes them scapegoats. Who they could along with them who would never turn them in because they want to be their friend. So it's a really important thing to watch for with this population. How involved were they? How much did they know? How much did they understand the consequences or potential consequences of the behavior? Trouble remembering new information. Do we have any probation officers here? We have some probation officers. How many times do you hear, "I'm sorry I missed my probation meeting, I completely forgot"? Every day, every single day, right? Maybe they forgot, maybe they really did forget. But we do have certain rules that we have to try to follow, one of which is probation, and one general rule of probation is you gotta show up to your probation meetings. So what do we do if we have someone who has or might maybe have an FASD, maybe we suspect it? How do we get around some of that, or can we?
Figure out a way to remember, whether it's setting an alarm or Post-its or a phone call or a buddy system or some sort of something to help still keep responsibility on kids and still help them.
Absolutely. We have to have some personal accountability. We can't say, "Oh, it's okay, we'll let you keep sliding because I think that you have FASD," right? It's not going to work that way. But we do have other things that we can help with that, whether it be phone alarms, having somebody remind them, having somebody bring them, a parent, guardian, caretaker, friend who's higher functioning, spouse sometimes. We talk when we're working with FASD about an external brain. And if you wanted to go home, I know Friday night you guys are going to go home and watch all the Morgan Fawcett FASD videos, right? Woohoo! But if you go home and you watch it, he'll talk a lot about his external brain. And lots of times people will use like a journal or a notebook that they keep with them to help keep track of information. A parent, guardian, friend, spouse, somebody that can help them remember the information, because it might be there and it might not. I've heard stories with the external brain, take like emotional regulation, for example. And I don't remember what to do when I get upset, so I keep getting really upset, and when I get really upset, I act out and it's bad news. Well, let's write it down. Let's put it in here. So then when you start to get really upset, all you have to remember to do is open your notebook. And when you open your notebook, your skills and what's worked for you in the past is there for you. Little things to help out. Left and right, poor visuospatial reasoning, just shows more of the effects of the brain damage. Secondary disabilities of FASD. We talked a little bit about that. Primary disability, brain damage. Secondary disabilities, things that happen in the environment because we have an FASD. The interesting thing with secondary disabilities, a lot of it's preventable. If we can intervene, we can make a difference. But we can take somebody who has an FASD and put them in the most amazing environment, supportive environment. You were talking earlier about adoption. We can put them in that does not guarantee a great outcome, because sometimes the brain damage is that severe. There's a lot of attachment stuff that comes with it. So we'll talk a little bit more about that. I'll give you a second to take a look at that. Your comments before I go into mine? See what you think before I tell you what I think? Yeah?
Where it says inappropriate, like predatory behavior or like fetishes and things like that?
Great question. And I'm proud of you for asking that, because that's when people kind of tend to skip over, where it's hard to talk about sex, especially when we're talking about people with developmental delays. But it's one of the key points I always try to bring across. Other comments, sexual behavior, before I go into my little 2 cents. You're all dying to know what I think, aren't you? Okay, so there's studies that show when a child has a developmental delay, FASD and autism are 2 of the big ones. There's a lot more studies on autism, but FASD is included. We tend to not talk to them about sex. We don't talk to them about safe sexual boundaries because we think they're special, they're different, they have a developmental delay, they're not going to be active sexually, it's not going to be part of their life, at least not yet, they're not ready. Maybe my other kids at 12, 13 were ready for some talking and some guidance, but not this one. So we don't talk to them. when we have an individual with an FASD who's 25, I don't know how old Morgan was in the video. I don't think he said, did he?
19.
Thank you. You guys are good. I've seen it about 80 times. Okay, so take somebody who's 19. Abilities of an 11-year-old. It's not uncommon to see about half. So if I'm 30, I'm not, but if I was 30, I'd be around 15, right? As a general rule. We don't know. They could have the development of an 8-year-old, 6-year-old, 12-year-old, 23-year-old. Depends on the abilities, but it's about half. So if I'm 30, but I have the development and the abilities of a 15-year-old, who's cool to hang out with? 15-year-olds, not 30-year-olds. I don't get them. They make no sense. And then people aren't talking to me about sexual boundaries, or maybe they are, and my brain damage doesn't make it possible for me to remember or truly understand the consequences of my actions. So then we get some of the predatory behaviors coming in. Oftentimes, and it's not an excuse, please don't think I'm coming across as an excuse, but oftentimes not really understanding that it is predatory or damaging to the victim, but what the brain kind of comprehends for the individual at that time. Make sense? So, just tell people, no matter what their developmental disability, the hormones are still there. The desire is very often still there, and even if it's not, better to err on the side of caution. Talk to them, explain to them appropriate sexual boundaries and what that means. Okay. Great. Could you guys hear that in the back? Also makes them more prone to be victims. And that's absolutely true. I've seen rates for FASD as high as 2 to 3 times more likely than other people to be victims of abuse, especially sexual abuse, especially in female individuals with an FASD. I don't think I've worked with an individual who's a female with an FASD who has not been sexually abused. Very sad. Yeah?
Also in the correctional system, they're marked.
In the correction system, they're marks. You said extortion?
Anything.
Yes. Extortion, all kinds of different things. You can see who's kind of the easier mark, especially like we said earlier, the more complex. So it definitely puts them at higher risk of becoming a perpetrator as well as a victim. Thank you for bringing that up. What do you guys think of mental health psychiatric problems, 94%?
It's real high.
It is really high, isn't it? We're saying almost always you are guaranteed you're going to have some kind of mental health or psychiatric problem. I would venture to say it's even higher than 94%. And a lot of people I know who work with FASD say, yeah, higher. It's, like I said, a lot of ADHD, lots of schizophrenia, lots of bipolar, depression, other things that are going to impact their functioning in addition to the FASD that's already impacting functioning. Involvement in the criminal justice system, 42%. That's the ones we know about, right? Do you guys think that's higher if we could go in and absolutely know everybody who has FASD? I would be absolutely shocked if that wasn't higher. School disruption, special ed. My first master's degree is in education. I come from a teaching background. I have the utmost respect for teachers, but you can only do so much. You're one person in a room of 28 kids, and you're expected to be able to teach to the lowest ability and the highest ability unless we can have a specific learning disorder that qualifies them for special ed. It's hard to get through educationally if you have issues. It's doubly hard if you have behavioral on top of it. Has anybody read the book, I'm going to give you all kinds of reading tonight, aren't I? Have anybody read the book Look Me in the Eyes by John Elder Robinson? Has anybody read the book or seen the movie Running with Scissors? Higher. He talks really, I'm not going to go into the truth of that, how true it is or how true it's not, but he talks very briefly in that book about a brother who had Asperger's before Asperger's was an official diagnosis. And there was such an outpouring saying, we want to learn more about your brother. We know about you in your environment. Tell us more about your brother. So the brother got smart and wrote his own book. Like any smart guy would. And he now travels. He was in Minnesota too a couple years ago. Somebody in one of my audiences had seen him speak. And he talks about Growing up with a developmental disability, before we were as sensitive to it as we are now, especially one like Asperger's where it wasn't even something recognized. And he talks about one episode where he was in the house with his mom and his mom's friend. Mom and mom's friend were talking about some news story of a plane crash somewhere in Africa or someplace really far away. And the mom and the mom's friend were doing probably what most of us would do. That's really sad. I feel very bad for those people. That's really heartbreaking that somebody would have to endure that. He got a big smile on his face. So the mom's friend said, "You're a psychopath. What is wrong with you?" This is what this guy heard his whole life. You're a psychopath. You're only going to pump gas for a living. Wasn't that the threat back in the day? You're only going to pump gas for a living. There's something wrong with you. You're going to be a serial killer. You're evil. All these things because he wasn't giving the socially appropriate responses. What he was thinking during that time was, that happened, and I'm sure that that is sad, but it happened far away. I don't know any of those people. I'm here in my house and I'm safe, and that makes me happy. There's the smile. If we can understand what's going on in the brain, it can make the responses make a lot more sense. And when we're not expecting culturally acceptable responses from somebody whose brain doesn't allow it. He got this his whole childhood growing up. There's something wrong with you, on and on. So finally he said, you know what? Forget it. Do the best stuff I can do. And he came up with some really creative ways to get in trouble. And he got into some trouble. He was able to turn that around in his life. And now he talks about having a family and something random like a car dealership in Iowa. But he talks about having a family and going out to dinner with his kids, and sometimes when he has a menu, he still rocks. It's just one of his stereotype behaviors. And when he does, now his kids will say, "Dad, stop being so autistic." I thought that was sweet. He was able to find the skills to get by, have a very successful life. But when we're looking at school disruption, it's for these individuals, especially when we're undiagnosed. Another quick story for you guys. The woman I told you about earlier who adopted the two girls with the FASD, both are pretty severely impacted. It's impacted more than the other, and she looks like she has an FASD. You can look at her and you can tell there's just something a little different going on, and the other one doesn't look like there's something going on. Who do you think is more successful in their life? I'm hearing both sides. It's a really tough question. Oftentimes, the one who looks like there's something wrong will do better. Why do you guys think that is? It seems counterintuitive, because you would think I'll be more successful in society if I look like I can fit in and do, yes? Absolutely. Societal expectations. When you look at Morgan, he looks like a very nice, highly functioning young man. We don't expect him to have so many issues and so many struggles. Where if we can see that there's something going on, our expectations are different and the services we put in place. The one who you don't see any facial features is trying to live independently and really struggling a lot. Whereas the one who has the facial features is in supportive group housing. She has staff that help her out, and it makes a big difference. Problems with yes.
I was going to say that 85 is did low by about 14 points. That's the area I work in, is in the employment and supported out in the community piece, and everybody with FAS. It's like, I haven't heard of anybody with anything below very low, very, very mild FAS who hasn't had one of their individual issues.
What do you guys think? Yeah, I agree. It's really difficult. And part of it is we have this magic thing in society where when you turn 18 or even 16 in some cases, you're supposed to be able to go out and function and get a full-time job and maintain an apartment and go to college and do all these things. Well, if I have an FASD, diagnosed or undiagnosed, I'm 18. On the inside, I'm really 9, 10, 11. I have a 10-year-old son. I don't think I'd want to give him his own apartment, right? He's very mature and responsible, but not to that extent. It's different developments for different times. And then even when we do reach that point, say we're 50, so really we're more 25, 30, maybe we've even caught up to have the development of a 40-year-old, we still have that brain damage, and we still have this dysfunction that's going to make it very difficult. Sheltered employment, group living facilities can all be very, very helpful. Yeah?
Struggles, I'm working with that population somewhat, but also some ADHD. Unlike, say, a diagnosed dyslexia or learning disability, or even AD, you get a certain continuity. And like there's always going to be this problem. And so you can extrapolate where that's going to get in the way. With an FAS or a DD diagnosis, they may be great on this little piece and think, well, then these other two should be great too. But no, not necessarily. You've got to test all those other two. So every single piece has to be tested out to see, does this work for you or not? They
Yeah.
can't make any assumptions based solely on what else you've done.
Absolutely. Where a very thorough neuropsych can come into play. You'll hear stories where maybe we have two individuals with FASD living together in a group facility and they want to go to the mall together. Well, one is really good at managing, absolutely not manage money. Both have FASD, differing abilities with the FASD. The other is, one of them is really good at crossing the street safely, looking both ways, can navigate the bus system where the other one doesn't. Well, let's pair these two together because one can get them there and the other one can help them manage the money once they get there. There's no assumption, great point, of what their ability or struggles might be because of an FASD, because it can be all over the board. All right, other questions on that slide before I move on? You'll see this name a lot, Anne Streisguth, if you can read that down there. She's one of the big pioneers of a lot of the research on this. Really big names, so if you're interested, you can read more from Anne. Yeah?
I have a related question.
Sure.
To this, but what if mom drinks while breastfeeding? Does that have similar effect on the child?
Great question. Mom drinks while breastfeeding. What are you guys' thoughts on that? You guys' that's a good word. Nice and professional.
I find that very disturbing because I think that little brain is still at such a critical stage developing, and everything you intake is going into your milk. Yeah. And the doctors would tell women, oh, drink beer, it helps you bring your milk in.
Yes.
But,
Drink beer, it helps you bring your milk in. A glass of wine is good so that you relax, so that you're more able to breastfeed. All these things, even during pregnancy, a glass of wine, a glass of beer is okay. I have not seen any specific research on breastfeeding and what that does, but I can absolutely see where that can have a huge impact because it is still going into baby. This is more directly. Have you guys seen those ads from, I think it's MoFast that put them out, where they have the toddlers holding the wine glasses? They're saying drinking while you're pregnant's just as silly, or something along those lines. We think of it differently when baby's inside, because it's still mom, we can't see baby. Where we think of it a little differently once they're out, but then breastfeeding is a common issue. We're drinking when we're breastfeeding, and how is that impacting? It will have some impact, but I don't have actual data in this to support how much is okay or how much damage will it do. Great question. Yeah?
I'm really surprised that the alcohol and drug use being at 22%.
Anybody else really surprised alcohol and drug use is only at 22%? Yeah.
That is pretty.
It's hard to get appropriate research in this. That's a great point. Thank you for
the
that.
past year, I've been inquiring of people and doing evaluations with, and those that suspect or are certain is closer to 85.
I believe 85.
Alcohol and drug services.
Yeah. I firmly believe 85. And I believe if we, again, knew everybody who has an FASD, it could even be higher than 85%. The brain gets used to of alcohol, higher rates of alcohol abuse, very high rates, alarming rates when we're looking at CD. So great point. All right, a little embarrassing confession. Does anybody else here? Well, did you? It's gone now. Watch the show Drop Dead Diva. I'm the only one. Awesome. I'm usually not the only one. You? Okay, nope, I'm the only one. All right. So for those of you that don't know, it's 2 women about my age, and it's a Lifetime. It was pretty sappy, but I thought it was cute. So anyways, one finds out she's pregnant, and they're, oh, we're girlfriends, we're so excited you're pregnant. And then the other one finds out about this big job promotion. So we're gonna celebrate, this is so exciting. Go to the fridge, pull out a bottle of what looks, and this is recent, this happened 2 years ago maybe, pulls out a bottle of what looks exactly like champagne out of the fridge. Opens that bottle, pours it, and they toast. What's wrong with that? Is there anything wrong with that? What's wrong with that? She's pregnant. Say it again. It's absolutely promoting drinking while pregnant. It's just a glass of champagne, it's okay. Maybe it was sparkling apple juice. I don't know, it didn't show the label to show that this is champagne, but we don't know. So it's taking a show that's aimed towards women of pregnancy age and showing one toasting with champagne while pregnant. Like it's okay. So, societal expectations. All right, here's another graph for those of you that prefer to see it that way. Primary domains affected by alcohol exposure. So a little bit more on this. We talked about the achievement, adaptive behavior, how they communicate, their social skills. Social skills are very complicated, and they come pretty natural for a lot of us. The mere act of getting in an elevator. Have you guys ever heard somebody talk about that? How many social steps are involved in getting in an elevator? Where do I go? How do I find the elevator? Which floor am I going to? Do I press the button or does the guy next to me? How close can I stand to him? What if our fingers touch? When I get in the elevator, which way do I stand? How close can I stand to this person? Do I make small talk? Do I not? Just the act of getting in an elevator can be a very complex social interaction, especially for somebody who's lacking in that area. Language, memory, motor skills, sensory, social skills, and executive skills. This is where we're talking a lot with corrections. Judgment, reasoning, impulse control. How many of you guys have worked with a client and time again they do the same thing? And they get in trouble for it every time. And you are beating your head against the wall. No, we never beat our head against walls, do we? You're beating your head against the wall saying, what can I do to change this pattern? It's not changing. We are not getting through. Maybe it's willful, maybe it's brain damage, not allowing that person to process it in that way. The judgment, you'll talk about it's not okay to cross streets, and I'm going to teach you without looking both ways, and I'm going to teach you at this street. Well, somebody with an FASD may not have the capabilities to translate that to the next situation. So the next time they're crossing a different street, well, you talked about that street. You didn't talk about this street. My brain didn't connect the two. You said I can't do this criminal behavior like I did at this time. Well, I'm not. I'm doing it in a different way. I'm not translating it. I'm not understanding the consequences. I don't really get why I'm getting in trouble for this because my brain's not letting me. It's absolutely abstract thinking. And for a lot of us, it's common sense. It just makes sense. I work with a guy who has Asperger's, and he wasn't diagnosed until his mid-60s. We just got him diagnosed. When he was, and you'll see a lot of similarities. I know it's Asperger's and an FASD talk, but you'll see similarities. He talks about his sexual offenses when he was in his 30s, I believe. So this is over 30 years ago. This happened a long time ago. And he went to prison for it, and then long story. But you'll talk about it and he says, I have no guilt. I have no remorse. And I served more prison time with that because of that, but that was fine with me because I liked prison. In prison, people took care of him. He didn't have this overwhelming thing out in society where he had to try to figure out his own life. The routine was good. 3 hots in a cot, you guys have heard? It's good. Some people like that, so they don't mind going back. They're not able to show guilt the way we want them to. They're not able to have that higher level abstract thinking that keeps them out of trouble. So a whole myriad can go into why we are seeing individuals time and time again in a correction setting. Yeah?
There's a lot of stuff, that you're saying with ADHD and stuff, and, we diagnose it very easily.
Great question. When we are looking at ADHD, there is a co-occurrence of ADHD and FASD, but there is also a very strong prevalence of, I know what ADHD is, and I know what autism is, and I know, especially ADHD, that's a big one, so I'm gonna slap that label on because that makes sense to me. We're not taught a lot about FASD. I've gone through school for counseling and education, brought up maybe twice the whole time. And you only know what you know. I'm not doing this to point fingers. You only know what you know. And we can't possibly be taught about everything. So that's where I give a big kudos for you guys for coming today on this beautiful Friday, because you want to learn about this so that you can better handle these situations. So we have ADHD that does co-occur. We have FASD that has ADHD tendencies, and then we have people that we're putting the ADHD label on because it's what we know and we're missing the FASD. Another key sign of FASD, did you ever meet with somebody and you say, what have you been diagnosed with in the past? Depression, bipolar, schizophrenia, schizoaffective, borderline personality disorder, antisocial personality disorder, and they start going through, well, I don't think it's possible to have all those things at once. So let's start taking a look at this. Lots of varying diagnoses because of the impact in functioning. So, great question. Yeah.
Question. And they haven't been diagnosed with FASD, and they go in for psychiatric evaluations, and they offer them the different medications with their brains in the shape that they are and the abnormal neurotransmission. How are the medications even going to work like they're supposed to if their neurotransmitters aren't, and you know, the chemicals are so off?
Great question. Very good question. Could you guys hear back there asking about medications? How can these medications possibly be effective? I'm medicating schizophrenia. Well, really, maybe it's more of an FASD thing, or vice versa with ADHD or whatever it might be. When we're looking at medicating FASD, there is no medication that makes it better, that helps. They're looking into some stuff to try to help better, but as of now, we don't have anything really solid. But what I can do is I can treat the ADHD with medication. I can treat the depressive symptoms with medication. What often happens is you'll find the medications might not be as effective. They might be, but they might not be. And we might have a really hard time finding a medication that works. We might find a medication that works fine for about 3 to 5 years, then all of a sudden it doesn't work anymore. So you'll see a lot of very regular needed contact with a psychiatrist, because that's always going to be changing, and it's going to impact them differently than it might somebody without that brain damage. Great question. Yeah.
I was just going to say that if you don't treat it with the medications, they're going to treat it themselves with alcoholic drugs. So it's kind of a win or a lose-lose. Or it could be.
Yeah, for those of you that couldn't hear, but if we're not treating it with medication, they're going to treat it themselves with alcohol and drugs. And I would venture to say, even in a lot of cases when we are treating it with medication, they're still going to try to self-medicate with alcohol and drugs, because we're not going to be able to get a firm grasp on the symptoms, high rates of trauma, all kinds of other reasons why we have high rates of alcohol and drug abuse. But great point. Absolutely. We can do what we can do in a healthy way to try to make their functioning a little easier, to reduce the likelihood of them abusing alcohol and drugs. Yeah?
Think about the thing from last year about stem cells. People with FASD. Have you heard, is there any development on that, or is it just still early development?
Still very early from my understanding, and way than me. But there is more and more research coming out. There's more funding coming out, things that we can look at to see what we can do to help. So great point. Another thing that I'm hearing that they're trying to study and find out is drunk sperm. Sorry for the crude language, but there's no better way to say it. Can dad impact this? Because is there alcohol in the sperm when we're, at the moment of conception, and how does that impact the baby? I was... You're right. There is a lot of those. I was at, see, I'm doing all kinds of embarrassing confessions today. I was at an adult establishment in Kentucky. I was actually at several. And when you are at a bar in Kentucky, there's a law that there has to be a sign that says, have you guys seen these? If you are pregnant or think you might become pregnant,